I want you to do some imagining with me. It's May of 2020 and you're 7 years old. You live with your younger sister, your mom, and your grandma in a small apartment in North Philly. A dangerous and highly contagious disease is spreading. It's killing lots of people. So you can't go to school, you don't really get to see your friends. Your mom, she's a cashier at the local Walgreens, and you've heard her complaining that the staff don't have enough masks to keep them safe, and she's worried that she's gonna get sick, and then her fears are realized. She develops a cough and a fever, and she knows how sick it could make your grandma. So even before you get the chance to wake up to say goodbye, she rushes to the hospital. Now, she should be okay. She's 35 and otherwise healthy, but good odds just aren't enough for her, and a week later, she's gone. Your grandma calls you in to tell you the news, and she's beside herself, having now lost her only child, and she's looking out into the future out loud, wondering how is she going to pay for the food and the rent? Your sister, she's holding on to you for dear life, screaming for her mom with tears pouring out of her eyes. And you're 7, you just nailed the double Dutch, and now you're looking out into the distance with tears rolling down your cheeks, wondering who's gonna help you. Some version of this has been a reality for more than 200,000 children in the US that have lost a parent or another caregiver to COVID-19. And like all things COVID-19, it doesn't impact everyone equally. People of color and low-income populations that are already facing significant challenges with insufficient resources have been hit the hardest. Black and Hispanic children are more than twice as likely as their white peers to have lost a caregiver to COVID-19. 70% of these kids are 13 years old or younger. Now, many will be resilient. They will grieve this death for the rest of their lives, but with the support of caring adults, they'll be okay in the long run. But others will face depression, symptoms of PTSD, and a future that might include substance abuse, school dropout, and lower earnings. I would love to tell you that 1 million COVID deaths in, that we figured this out, that there's a comprehensive plan in place to find and to help these children, to give them in a coordinated and systematic way the social, emotional, and financial resources they need to get through this period relatively unscathed. But we're not there. And this problem isn't just going to disappear, it won't go away. The number of orphan children continues to climb, and their need for support and resources will only grow the longer we keep our heads in the sand. Now, I'm under no illusion that we're going to solve this problem in our few minutes together, but your consciousness of this issue and your desire to act need not disappear when you leave that room. Each of you, if through nothing other than your affiliation with this university, has some amount of privilege and power. I ask you to use it. Use it to support the leaders and nonprofits actively working to prevent more COVID deaths and the ones who are investing in the infrastructure and services that these children and their families and their communities need to persevere. If you are in any way moved by that hypothetical story, but all too representative story of that 7-year-old, do not let those emotions fade. Do not let this pandemic pass without taking action to support these forgotten grievers who so desperately need your help. Thank you.